You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by Lee Acey, Communications Director for Mayo Clinic in Rochester, Minnesota, to discuss which social media platforms clinicians use to enhance their practice, guidelines, and risks to be aware of, and positives of implementing social media in healthcare. Thanks for joining me today, Lee.
Thanks, Stephanie. Great to be with you.
So to start us off, how has social media shifted the healthcare landscape?
Well, I think in one sense, social media is as old as human speech. And in healthcare, people talk, that's one of the things that people are most likely to talk about is their health. I mean, that not just in healthcare, but just in life. And so people have talked about their experiences with various clinical experiences, hospitals and other clinics. And that word of mouth sharing of information is something that has been important as long as human speech has been around. What digital social media tools have done has been to really amplify that, to be able to overcome the barriers of time and space instead of just across the back fence, talk with neighbors or just in casual conversation. People are much more public about their sharing their experiences and their information, their knowledge. And that has really, for good or bad, has enabled people to has enabled information to spread. So whether it's good, solid, reliable information or stuff that isn't so good, what social media does is really give legs to those conversations and that information, and has a much bigger impact.
Great. Which social media platforms were the first to be used in healthcare?
Well, this has really gone back in terms of the electronic platforms. I mean, people started to, where it really got going was when Blogspot or, Blogger became available. But there were online message boards that, in the 90s, 2000 or early 2000s, when it got to really be what you'd maybe call social medias, when, MySpace and Facebook were launched. Those went from just sort of the Spartan interface that you had with some of the, online groups. I remember Yahoo groups and others like that, to where people started spending a significant amount of time online. And I would say that Facebook, when it launched in 2004, but also then YouTube were some of the early platforms where people began to, in earnest, make these connections.
And it's amazing how fast they have all really grown, and the connections that people do have, whether it's close by in their city or state or internationally, for sure.
Yeah, well, so for instance, I remember I have a great example of someone who came to Mayo Clinic, and I got in touch with her because one of our physicians, put me in touch with her. But she had a son with a really pretty unusual condition that there probably wasn't one other person in her state who had. And she told the story about how she went on a Yahoo group that was organized around this particular heart condition, and through that, got this recommendation that she should go see Dr. Mike Ackerman at Mayo Clinic, because he was the author of the studies that they were talking about. And, that's just the, where she couldn't have had a face-to-face meeting with anyone who was in that same condition, that same position. As a parent of a child with this rare heart condition, she was able to make connections with lots of other people who had similar experiences and able to make a good treatment decision for her son.
Wow, that's amazing. So you talked about a few of the early and beginning platforms that were used. What social media platforms are used in healthcare, and how are clinicians using them?
I think the platforms that physicians use really depend on their goals, and physicians, other clinicians, nurses, and other professionals. I think for those who are interested in making connection with other professionals, a lot of them use Twitter, because the virtue of Twitter, and it's weird to say virtue and Twitter in the in the same sense. But one of the real benefits of Twitter is the use of hashtags, where you're able to make connections with people who you don't know yet. I like to say Facebook's for your friends and Twitter's for the friends you don't know yet. So people gather around hashtag conversations on Twitter, and they make those connections with people who share a common interest. And whereas Facebook is a much more patient and consumer-oriented platform, and certainly there are professionals there are patients using Twitter, especially the super e-patients who are really highly engaged. But for those who are looking to make connections with other professionals, there's really no better platform than Twitter. LinkedIn is used in a similar way. It used to be more of just a kind of an online resume, but now people are able to publish, more extended thought pieces. Everybody's able to publish those. And so people use that for, professional position and development. For engagement with patients and consumers, they're using Facebook, also YouTube. That those are some of the basic, I used to say the 4 basic food groups of social media are Facebook, Twitter, YouTube, and blogs. And LinkedIn has kind of, enabled essentially anybody to have a blog without having to have the installation and upkeep. They're able to have that longer form essay opportunity. So those are some of the real staples of engagement. And what we encourage our clinicians to keep in mind is who is it that you're trying to reach? And then what is it that you're trying to accomplish? And instead of just immediately defaulting to, social media means Facebook, they need to think about what it is, what's their goal, and who are the people that they're trying to reach, and where are they hanging out.
I like the 4 basic food groups. That's great. So what are some of the newer or lesser known social media platforms clinicians are using?
Yeah, and so this isn't really newer or lesser known, but or people who are really interested in imagery and that kind of sharing. Instagram's a great platform. One of the other newer ones is TikTok, that skews a little bit younger. Obviously, Snapchat is likewise skewing younger. So if you're interested in the teen or young adult audience in particular, those are some of the ones that some folks have been using. Mayo Clinic hasn't taken the TikTok plunge yet, but and definitely there are some lots of good uses of that platform. But it all comes down to, if you've got a good strategy, a lot of these platforms present really good opportunities.
You mentioned TikTok, and I would have never even considered that, just knowing what my kids and their friends who watch that. But, when you mentioned knowing your audience and who you're trying to reach, what an amazing way, if you've got a great way to use that with a pediatric group of patients and kind of how to engage them and bring them together. So that's very interesting. So what are the positives of incorporating social media into clinical practice?
There's probably more positives than we have time to get into at this point, but I'll settle on a couple of them. The first is that you have an opportunity to really positively impact overall knowledge and health knowledge when a clinician gets engaged in social media. So there's going to be plenty of people saying bad things and saying unreliable things in social media. But if responsible professionals get engaged, they're able to, ensure that the good information, the quality information is available as well. And so that, has just a general societal benefit. On a real practical, tangible perspective, when you think of perhaps something that you might tell patients 10 or 12 times a day, kind of a standard spiel or presentation that you make, information that you share, by putting that in social media, by YouTube video where you say that provides an opportunity, again, as I said before, for the people more broadly outside of your practice to get that information, which will be good for them. But then secondly, it might have real efficiency benefits and practice enhancement benefits, within the patient population that you're seeing. So for example, if you're having a conversation in the fall 10 or 12 times a day about why your child should be vaccinated, if you do a video It's possible that you could send that out in advance to your patients, or when they're roomed for their appointment, hand them an iPad that has the video called up and ask them to take a look at it before you come in to see them. And then after they've watched it, instead of you having to go through that thing that you say over and over again, you might say, so after that video, what questions do you have? And that way you've kind of gotten the basics covered, and you can go to a much deeper level, or, to mix metaphors, to elevate the conversation, to go beyond sort of the standard things. So it might make you be able to get through that part of the appointment more quickly. Or even if it doesn't, it gives you a chance to really gauge understanding, increase understanding, and communicate at a more effective level.
That's a really great example. I think that when we do that, that also takes into account the different ways that people learn and understand, because, we could hand them a pamphlet or we could talk to them. But when you do have something on, whether it's video or, that we're, like you said, you're kind of getting to them ahead of time, that does give you the opportunity to kind of open it up and put it in a way that they have the opportunity to say what they may not have understood, where before it was not as easy for them to do.
Well, one other thing I just add is that sometimes, like, how many times do you, for instance, have to show somebody how to, wrap an ankle or wrap a leg or something like that, and they're like, they get home and how do I do that? And they see that the thing's all wrapped. But like, how did she do that? How did he do that? So if you have a video that demonstrates how to do that care, for instance, that's something that saves them having to call you back again and saying, asking for instruction. And it just leads to them doing a better job, complying and providing the care that they need for themselves or their family.
Exactly. And with the healthcare community having more and more patients going into the outpatient arena or having caregivers at home, what a wonderful way to give them that security of, I don't remember what they told me in the hospital. There was so much to remember, but here I can go back and watch a video and look at how that was done again. So that is really great. What professional boundaries and risks do clinicians need to be aware of in using social media?
The first thing they need to make clear is that they're not offering direct medical advice to patients, that they're not creating a clinician-patient relationship by their engagement. If people have specific questions, they need to be referred back to, they need to get an appointment. I'm just offering general advice here, just general education. So it can't be a substitute for direct clinical care. It can be an enhancement of education. So part of the thing that they need to keep in mind is, and I'm thinking particularly on Facebook, there's a lot of information that people share on Facebook, things about their family and things about, where they live and all that. And there's a great, and by great, I mean bad, potential to break down the sort of professionalism barrier that should be there, the professional distance that should be part of the clinical engagement. So we really recommend that, first of all, that clinicians be sure they check their privacy settings, that what they publish is for friends only, or maybe friends of friends, unless it's something, totally educational or innocuous that they want to, put out in public. And then secondly, we strongly recommend that clinicians don't create a friend relationship on Facebook with patients. You can engage with people on Facebook in groups, for instance, or on public pages, but by having that friend relationship, that creates a closer level of sharing than is really appropriate in that clinical relationship. The other benefit of that, and so we have that published as one of our guidelines, and it's one of our, employee guideline for all Mayo Clinic employees. And that really actually helps our physicians and nurses and other clinicians, because when they get a patient or a parent who they're staying for an extended time and they get to know the clinician and they send a friend request on Facebook, then they're able to respond and say, well, it's really against our guidelines. I'm not supposed to do that. So then they don't have to be the bad guy. They don't have to be the party pooper. They can say, it's part of our guidelines. The one exception that we put on this is that if the personal relationship precedes the clinical relationship, then that's okay. I'm friends on Facebook with a high school classmate who also was for a time my primary care physician. And that's okay because, we knew each other in high school. But the rule that Dr. Fairs-Tamimi, who's our medical director for social media at Mayo Clinic, uses is the breaking bread rule. If it's a patient with whom you would have dinner, then that's someone that would be okay to be friends with on Facebook.
That is great that you have those guidelines set in place because that can be very difficult when you are spending that much time with patients and families and they do reach out in that way and, want to have a friendship and they feel very comfortable. The nurses are the most trusted professionals. So they feel that way and they feel that there is that kind of a relationship in there. So I could see, I've experienced having patients and families wanting to go that extra step, but it's great to have that to fall back on from your employer.
Yeah.
Mm-hmm. Absolutely. Yep. So how are patients using social media for health reasons? And what does this mean for oncology nurses?
Yeah, I think there's definitely a growing subset of patients and their family members who are much more empowered and are looking for answers. And so they're out searching and making really positive connections with others who are sharing, some of their similar challenges. And so it's a huge benefit for patients to know that they're not alone, and because they often feel isolated, and especially in the COVID-19 era, even more so. And so being able to make those safe connections is really great. We have, in addition to the general purpose networks like Facebook and Twitter and LinkedIn and YouTube and all those, at Mayo Clinic, we have a platform that we created called Mayo Clinic Connect, which is at connect.mayoclinic.org. We only have 1 million or so followers on Facebook. We've got just about 100,000 in this Mayo Clinic Connect community. And so this is a place where patients are able to find others who share their health challenges or interests and concerns, and they don't have to use their real names. So that's one of the downsides of Facebook, for instance, is the real name policy. When people can feel more comfortable sharing their information, their struggles, because they're behind a screen name that it's only whatever they divulge about themselves is the only thing that's out there. So they're definitely looking for recommendations on, where's a good facility in our Mayo Clinic Connect platform. They're looking at, travel logistics and other things like that, but also just, what's it like for people who've been. And, when you speak of oncology nurses and oncology patients, when we started our Mayo Clinic Connect community, we had one group for cancer. We had about 20 groups altogether, but one group was cancer related. And then as people gathered there and suddenly there's a large group of people, women particularly, talking about breast cancer, well, then we split that off into a different group. And then there's the breast cancer group. And now we have about 16 groups that are related to cancer. And so you can get very focused on a group of patients and caregivers who are really in tune with that experience. But they're, so it's everybody at different stages. So, and people who are just newly diagnosed are wondering about, so what's next? And then as they move on and they get more, they have more experience, then we find them returning to give back. Everybody has some level of knowledge gap that they're looking to fill, but they also have knowledge that they can provide the community as well. Well, what we found is that there's a real sense of altruism within the patient community that we recognize, hey, we are in this together. And if I've benefited from the community, I feel a responsibility to give back.
That's great. And that is such a great way. I agree with you with you don't have to use your own name and the difference in that versus Facebook and, being able to ask those questions and not feel like, oh, but they're not going to know who I am, so I don't want to ask that. Maybe they don't feel comfortable in asking the question or reaching out, but, being able to have kind of that anonymity on who it is that's asking the question and putting that out there is really a nice way to do that. So this next question that I have for you, it kind of goes along with what you were just talking about and how patients are using social media. And as nurses, we tend to be the ones who patients will sit down and talk with because we do spend a lot of time with them. But we also see that, and you alluded to this before, the inaccuracy of some health information that is shared through social media. So how can we be prepared to support our patients with questions that are, they come with that maybe they're getting inaccurate health information when they're looking on social media? And what can we do, or how can we be prepared for those types of questions and discussion?
Yeah, well, so a couple of things to think about here. There's a saying in sports that the best defense is a good offense. And then the other saying is from high school chemistry: the solution to pollution is dilution. So if you've got there will be bad information on the internet. That's just going to happen. That's like a non-negotiable. It's not preventable. But the opportunity then is for the healthcare professionals who have the scientific background and clinical expertise to really share good information. And that we really believe that will rise to the top, that will be valued by the community. There will always be people that'll be trafficking in rumors and bad information. But by being there, by being engaged and positively sharing constructive information, that's a way that professionals, clinicians of all types can really make a contribution. And by being engaged, you also are more aware of what might be coming. That this is a common thread that's out there, and no, that's not right. And you'd be more prepared in the moment instead of it kind of coming out of left field that, well, I haven't heard that before. So you don't have to spend a lot of time doing that. And part of what we stress is finding ways to work it into the engagement into your regular workday and finding those micro slices of time to engage a little bit. That can create a very positive outcome.
Great. So you were talking about the Mayo Clinic Connect. Does Mayo Clinic use social media to enhance the patient experience in any other ways?
Well, so we use the general purpose networks as a way of reaching the patients where they are, patients and consumers, and, ensuring that just what I was referring to previously is that we want to put out good information that will be helpful to human health and that will be reliable and trustworthy. And that has a side benefit for us as Mayo Clinic for people to come to have, some kind of relationship with Mayo Clinic so that they'll consider if they come to a serious or complex condition where they think they might want a second or third opinion, that Mayo Clinic will be, in their consideration set. So that is the first way that we do it. Mayo Clinic Connect is our more in-depth platform for relationships, but we do Facebook Live Q&A sessions with physicians. We do videos on YouTube with our physicians and nurses and other providers. So it's for all of that. And just another great example with COVID-19 is having a video tour of what are the precautions that we're taking now to make it safe for patients to return for care. What can you expect when you show up in terms of having your temperature taken, the masking requirements and all that. And so with all of that, we, and tours of the facilities so they can help, navigate through their visit. So there's just any kind of communication that previously would be, difficult to accomplish because of the barrier breaking of social media can just be much more practical.
Right. And you bring up, with everything going on with COVID and just the enormity of all of this, whether that's talking about telehealth or, the patients that maybe don't have access to social media and how we are getting the information out, those are all pieces of, what is happening currently and how that is going to change our healthcare in the future as well. And probably that will impact how social media is used going forward as well, and probably the importance of that. Another thing I'd like to ask you about is when we're talking about social media, and you talked about the different types, the 4 food groups of social media earlier, there are a lot of people that use all 4 of those types, especially with younger nurses coming out of nursing school, and they've grown up with social media essentially. But a lot of seasoned nurses that are in practice, may not be as comfortable using the social media or may not care to use social media. So when we're trying to look at how that is being used in clinical practice, can you talk about the influence of utilizing social media, whether it's the students that are coming out of school, clinicians coming out of school and going into practice now, and then how are the seasoned clinicians that are learning how to use that more, kind of how is that working out as far as educating clinicians on utilizing it and, whether it's appropriate or important to use in their practice?
Yeah, that's a great question. So in 2010 at Mayo Clinic, we created what was then called the Mayo Clinic Center for Social Media for just this purpose, to help our Mayo Clinic colleagues across the enterprise be able to effectively engage in social media and to know the ins and outs and the right ways to do it. And we had a parallel group that was then called the Social Media Health Network. That all came together in 2015. The two merged together into one group that we call the Mayo Clinic Social Media Network. And so that's a resource for people who are professionals, who are maybe seasoned professionals, as you said, who say, I want to know about this and I want to learn more, but I don't want to just kind of Google and find things out. And I'm also super busy. How do I figure this out? And so it's a community, and it's free. It's at socialmedia.mayoclinic.org. And it just like our Mayo Clinic Connect community, this is a parallel community that's for medical professionals who are interested in learning about using social media. But back in 2011, we created a program called Social Media Residency, which it's just like medical residency, only it's 3 years shorter, and we don't keep you up all night. It's just one day. It's a one-day crash course. And, and when we started it, it could be pretty basic because, there were a lot of people who were really unfamiliar with the platforms. And so we could just give people a chance to use Twitter hands-on and, learn through that, setting up their account. Well, in 2015, we developed an online supplement to this because over the years, we had increasing proportion of the participants in that one-day program who were already coming and I've got my Facebook, I've got my Twitter, got LinkedIn. I want to know how to go deeper. And yet we wanted to be accessible to our people who are just kind of finally wanting to take the plunge. And so we developed a 3.5-hour modular program in collaboration with Hootsuite that is one of our premium offerings, but it gives people a chance to do a 20-minute module on Twitter basics, and 20 minutes on Facebook basics and privacy settings and all that, and LinkedIn and Pinterest and Instagram and some of these others. And so for the more seasoned professionals, that's a great resource because they're saying, yeah, I want to learn this, but I don't have forever. And I want to make sure I can do this in a way that's going to represent me well and not make me look like a newbie or a rookie when I'm out using it. I want to not make a faux pas that's going to sort of out me as not one of the cool kids. But then we also, as you mentioned, you've got the younger professionals who are, they're very familiar with the platforms, but they haven't been a medical professional before engaging in these platforms. And so another module that we have within this course is on professionalism. And so there's the different needs that people have. And so we definitely are committed to saying we want to be a reliable resource for those who are healthcare professionals who want to know either how do I use these platforms technically or how do I use them professionally. So that's a big initiative for us. And then as part of this, and just in keeping with the DNA of Mayo Clinic, we got medical society meetings, and one day those will go back to being in person again. But, there's been a long tradition of people gathering for nursing meetings or medical specialty meetings to share best practices and learning. And so this is what we do through this platform at socialmedia.mayoclinic.org is, again, it's free to sign up and you can participate in the discussions there. And we recommend actually in this one that people do use their real names because it's more about, learning together, and they're not talking about their medical conditions, but they're connecting with others who are interested in learning about using social media in healthcare.
I like that a lot. That really gives you the hands-on and a safe environment to learn what is the right way to utilize that.
Yeah, and just as the patients, have this ethos of wanting to pay it forward and to help others, after they've been helped, we have that same thing in this community. These are people who generally see the positives, the benefits of using social media in healthcare, and they want to encourage others and they want to be helpful. And so what we're providing, I like to use the analogy of a catalyst. We're providing the substrate where this is a place where these conversations can happen, and it's a safe place to ask questions. And we're definitely seeing people finding it helpful as they're beginning their journey.
Great. Are there any other resources that you could recommend for nurses who might want to learn more about social media and how to use it within their clinical practice?
Yeah, as a matter of fact, if you go to our site, socialmedia.mayoclinic.org/nursing, we've created a special landing page that we used for our Mayo Clinic nurses that gives them some Q&As related to particular nursing applications. We recognize that 25% of our Mayo Clinic staff are nurses, and that's, 66,000 people, divided by 4. That's a pretty big number. So we wanted to be particularly of assistance to them. And so our chief nursing officer 3 or so years ago recognized that this is a need that they had for Mayo Clinic nurses. And again, in keeping with our Mayo Clinic DNA, we said, hey, let's put this in a place where other nurses could find it helpful as well. And so, socialmedia.mayoclinic.org/nursing.
Great. That's a great resource. Wow. Thank you. So as we finish up, what is something about social media that's not often discussed, but you wish more people knew about?
I think people tend to gravitate to the horror stories, and they hear about the horror stories, and they then, because of that, can be too risk averse. And it's important to be appropriately cautious and to be careful, in social media. But I think, I'd like people to really understand, the immense benefits that people can find professionally and in their journey as healthcare consumers too. Well, and, one other element, I guess, is just in the opportunity for professional advancements for younger professionals. So we've seen people that are part of professional societies able to advance much more quickly than they otherwise would. And this is true both of physicians and nurses, all professionals like this, that by using social media, they're able to make connections with other professionals, like using Twitter at a conference. They're able to be smart in public. Lots of people are dumb on public, do stupid things in public on social media. But by saying smart things, by reacting to journal articles and sharing those, and kind of build a following. And we've seen people advance to leadership positions within professional organizations at a much younger age than they otherwise would, because they're able to distinguish themselves in a way that otherwise they would have just been part of the crowd. And so that's one really overlooked opportunity, I think, that people should be aware of.
I have to agree with you on that. I think we have seen that at ONS as well, with up and coming members and people who are on social media and on Twitter. And you're right. I like that statement you made, being smart in public, because you're right. There's a whole lot of the opposite out there on social media, but what an amazing way to spread your reach and get to know people through these avenues. Do you have any final comments for us today, Lee?
Well, the last thing I'd say is it's not too late to start. In 2006, I started my personal blog. And I thought, oh, wow, I'm way too late. Back then, because blogging was, people have been doing it for 4 or 5 years. And I said, oh, I'm really late to the game. Okay. And I thought that was late. The reality is that a year from now, you'll be a year older, and you'll either be, more engaged and have made some progress in this or not. And so it doesn't take a lot of time. It's something that, you get what you put into it, you get out of it what you put into it. But it's, by starting small, focusing on 1 or 2 platforms that align with what your professional goals are, whether it's patient outreach or whether it's professional advancement or personal reputation management or just learning and connecting, it's totally possible to, for instance, on Twitter, never tweet, but use it as a great news feed that saves you a whole bunch of time because you follow a bunch of smart people who are interested in the same things, and they're sharing their reactions to the journal articles that you would like to keep up on. They're serving as your bird box and helping you find those things. So that's one perfectly valid way of using social media. The point is that these are power tools, and just like a power saw helps you do a lot more than a hand saw, these tools can help you communicate, much more effectively. At the same time, power saw can do a lot more damage than a hand saw. And so you want to get the right training, the right guidance, and we're glad to help provide the tools and guidelines and training to help use these tools effectively.
Thank you, Lee. You've really given us a lot of great information, great resources, and that last comment, it's not too late to start. That's perfect. So thank you for being with us today.
Thanks so much. I've enjoyed it.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.